Yes. Yeah. Hi, Mike. Thank you very much for being with us. Really, we are honored having you in our conference as a keynote presenter, and thank you again for your time and your consideration to support the early intervention system in Turkey. And it's a big honor to have you again one more time, I will say. Yeah.
Well, thank you so much, Ibrahim. And I really appreciate your inviting me really here today to talk about my perspective of future directions for early childhood intervention. Next slide, please. So as you all well know, early childhood intervention consists of the intensive provision of specialized services and supports. And we do expect, when we do so, that systematic, comprehensive, and experientially based early interventions will have two major effects. First, it will enhance the development of children already exhibiting delays or disabilities, whether we know the etiology of those delays or disabilities or not. We certainly want to alter the trajectory of children's development and hopefully as well to prevent any secondary complications from occurring. Second major area of early childhood intervention is to prevent delays from occurring at all, or at least minimizing those delays for groups of children who have established risk factors. Next, please. So the topics that I want to talk to you about today are bulleted here. I want to talk to you just a little bit about the current status of early childhood intervention. Then I want to spend some time in talking about developmental science, intervention science, and just very briefly, intervention science. And then conclude with my perspective of the future directions for early childhood intervention. Next, please. So with respect to current status of service and supports, let me just talk about high resource countries such as the United States to give you an example of the long process that's required to create these kinds of services and supports. In the United States in 1975, actually, it was the first law that was passed that allowed children with delays or disabilities to be enrolled in public schools. But it amazingly didn't include children birth to 5. And so there was almost a 10-year period where there was a great deal of lobbying and work done in order to encourage the United States to pass a law, which it did, Public Law 99-457 in 1986, which provided supports for families and children and services for children birth to 5. And from then, it was a very difficult process of creating all sorts of model programs, different states in the United States gearing up in order to create early intervention services. And indeed, today, without any question, at some level, for all children whose families seek those services, it's expected and accepted. Next slide, please. Paralleling those kinds of services and supports were a lot of policy initiatives where various service system sectors, which are essential for providing early childhood intervention, beyond education, but included childcare, health, social services, and mental health. And those were all coordinated in a way to create a true early intervention system, which is without question in place today. Next, please. Now, the situation, as you might imagine, is quite different in terms of services and supports for low and middle resource countries, with about 25% of children in those countries at risk for or with an established disability. Those are large, large numbers. The World Health Organization, along with UNICEF, certainly recognized this a number of years ago, and I was part of this particular process, developing long-term strategic plans to try to build infrastructure in these countries, provide professional training, combat negative attitudes, which was a serious problem to be sure, and also develop wherever possible primary prevention programs. These kinds of things are ongoing today in so many diverse ways, and it is certainly an important activity for our early intervention field. The next slide, please. Well, supporting this work worldwide is the International Society on Early Intervention, which was created over 20 years ago, having conferences and lots of other activities. Ibrahim, I must say, was been a leader for the International Society of Early Intervention, and I thank him for the participation of so many people from Turkey in these conferences and other activities. Next slide, please. So we have, it's important to think about some of the reasons for the progress that we've made certainly in the last 50 years with respect to early intervention, and also consider the reasons why that's important when we think about the future of early intervention. I would argue that one of the main reasons for the progress that we've made to date is the integration of science and practice. And as you can see here, it includes developmental science, information science, and implementation science, which are integrated in overlap to some degree to create what we currently have as early intervention practice. And in my comments today, I will go through these various aspects of the integration of science and practice and let us, in an attempt to establish a framework for the future of early intervention as I see it. Next slide, please. So why have all of you here? Why is there such great interest in the field of early intervention, and why do we focus on this particular period? And I think there are a number of reasons. The first, I would think there are pragmatic, humanitarian, and equity reasons. We sort of meet the family for sure, their needs in what is unquestionably one of the most stressful periods of their lives. Our goal certainly is to help families and support and strengthen them wherever possible. And we really want to ensure access for all families for supports and services at the earliest possible time, and that makes most sense. But it's the fourth bullet that is very important as well, with families-centered supports and services, as they have become really the central feature of early intervention programs. And we'll see as I talk today how these family-centered supports really provide a guiding framework for all of the things that we do in conjunction with the bullet point, as you see at the bottom, the linkage in the developmental perspective. Next slide, please. The second reason why we focus on early childhood period is the plasticity, I think. We really, during the first 5 years, I think you'd all agree, we have a really unique window of opportunity to alter the developmental trajectory of children and families and to create a meaningful early intervention system. And indeed, we have a number of neurological and neurobiological and behavioral mechanisms. First 5 years is a period of extraordinary responsiveness to environmental input. And we also have the notion of a developmental cascade where small changes during the early period can create rather substantial changes as time goes by. Next slide, please. And just the third reason why I think it's important that we are gathered here to focus on early childhood is thinking about it as an investment in long-term benefits. Certainly there's a financial perspective and better job opportunities later in life, but it's also the case, and probably as important as anything at all, improvements in the quality of life of children and families, and then ultimately as adults. Next slide, please. So with that as a background, let's just take a moment to talk about who these vulnerable children are. They are extraordinarily diverse, as everybody in this room knows, and extraordinarily complex. One way to think about it is in categorical ways, and we have done so over the years. Children at environmental risk, children at biological risk, particularly preterm birth and genetic risk factors. A large group of children with developmental delays, heterogeneous group, and of course, the increasingly larger number of children with autism spectrum disorder. Next slide, please. Just to drill down on this a little bit, the characteristics of children at environmental risk. These are a number of the bulleted points reflect risk factors of financial instability, particularly food insecurity being the primary. Parental mental health issues certainly put children at environmental risk. The absence of a stimulating environment, particularly language directed to the particular child that we're talking about. Parent-child relationships, stresses there can create environmental risk factors, as can toxins such as lead and air pollution. Material resources, the absence of those material resources, as well as the inability of parents to really solve problems related to their child, which often happens partly and sometimes mainly as a consequence of limited community resources. Next slide, please. With respect to children at biological risk, the largest group, of course, of children born preterm. But we also have other biological risk factors, like this hypoxic ischemic encephalopathy, infection, which usually grows over the first 5 years of life and becomes manifest during that time, birth trauma, to be sure, and known genetic risk now. Probably the primary example that you're familiar with is the fact of having a child who has an older sibling with a diagnosis of autism is at substantially increased risk as a consequence of genetics for not only autism, but for other developmental disorders and delays as well. Next slide, please. Then that third category of children with broad-based developmental delay. The bullet points of cognition, language, motor, social, emotional, and sensory perceptual development are all well measured and well understood characteristics in developmental science, and delays in any one of those areas obviously contribute to problems later in life. Next slide, please. And finally, autism spectrum disorder. Its incidence has been increasing for a variety of reasons that I won't go into in detail, but the fact is it's a large group of children reflecting difficulties in reciprocal social behavior, repetitive behavior, and showing restricted interests. And really, there are broad-based communication concerns and relationships. Next slide, please. So a reasonable question is, now with that as background, what happens in the absence of early intervention? Well, it turns out that although there is certainly major variability in subgroups, but that for each of the 4 groups that I just described, in the absence of early intervention, there is a substantial decline in development over the first 5 years of life. Next slide, please. So it's important from a developmental science perspective to understand why do these declines in development occur over this particular period. Well, it could be a number of factors, and indicated by the bullet points here. It could be emerging genetic influences, could be the toxic burden I mentioned, such as lead or air pollution. It could be an artifact, really, of some of the more complex test items that we administer to children as they get older. Those are all reasonable possibilities for understanding the declines in development that occur over time. But what I want to focus on is the last bullet point, that perhaps some of that decline, or a substantial amount of that decline, could be a consequence of less than optimal environmental experiences. Looking at that a little bit more closely, as you can see from the blue, it allows children's biological or experiential constraints to exert an unusual level of influences on environmental experiences, and I call those environmental experiences family patterns of interaction. So the next slide reflects those. Next slide, if you could. The next slide reflects some of the more details about these family patterns of interaction, and particularly focusing on the major headings of parent-child transactions, family orchestrated child experiences, and the health and safety provided by the family. If you go to the next slide, we can take this model a little bit further, and you can see it reflects that these family patterns of interaction, these three family patterns of interaction, are connected to children's social and cognitive competence. And at the bottom, family resources are important factors that govern the quality of family patterns of interaction. The next slide, please. And it moved very quickly. There we go. And if you could just stop it. Yes, that's just fine. What you just saw was an indication of the fact that each one of these 13 components of parent-child transactions, family orchestrated child experiences, and the health and safety by the family has been determined by developmental science to have a very strong positive impact with high quality factors for all of these components on children's social and cognitive competence. And in point of fact, that although we have lots of individual differences in children, there are adjustments that are made by families to the various social and cognitive competence of these individual children that provide optimal experiences to maximize children's social and cognitive competence. But also as seen here, you have a set of stressors that children's behavioral patterns, the competencies that they develop, can often create various stressors to families as they work very hard to produce as high a quality set of family patterns of interaction as possible, and can even affect, as you can see in the arrow for stressors, all the way affecting family resources. Next slide, please. Now, taking this another way, we can, if you look at the right-hand side of the slide on opportunities and constraints, we can see social and cognitive competence of children can create for some families the potential for stressors, and stressors to family patterns of interaction, as you can see, and that can create possibly a non-optimal environment for the child and influence children's developmental resources and organizational processes, which are the child characteristics which govern their social and cognitive competence. And you can see by this cycle here, for those circumstances where stressors do occur, how you might see the decline in development that occurs over time unless some kind of intervention, early intervention in particular, is put into place. Next slide, please. So in many respects, with this developmental framework, we have a conceptual framework for early intervention, as we now have through developmental science, have a pretty good understanding of the theory of change. We really do now have a very good understanding of the developmental mechanisms that promote child development. And I found it most convenient to categorize them in those three areas that I've mentioned before and bulleted here: parent-child transactions, family orchestrated child experiences, and child health and safety. Next, please. So let's take this a little bit more deeply and focus on some of the details. If we look at these family patterns of interaction and focus specifically on the parent-child transaction and their assessments, we want to assess an instructional partnership that occurs between parents and children, and a discourse framework, the conversations that occur between parents and children, and the socio-emotional connectedness that occurs between parents and children. And we really do know from developmental science what the building blocks are, as reflected here. And they are generally categorized, as you can see on the bottom of that slide, sensitive responsiveness, positive affect, and engagement. And if we go to the next slide, if we do see child social and cognitive competence creating a stress to family patterns of interaction, and it turns out to be stressors to parent-child transactions, would be helpful to create assessments for each one of these. And we actually, in developmental science, have some very good assessment tools, particularly from the perspective of parents. We can look at a discourse framework and we can measure the expansions that parents make, how well they model various aspects of the environment for their child, how they provide responding that is contingent. All of these are characteristics which I'm sure many of you are familiar with. With respect to instructional partnership, it's important to create scaffolding and within the zone of proximal development. And in building social emotional connectedness, we can certainly measure the security of attachment as well as many other kinds of things. So we have an assessment that can measure parent-child transactions as well as all of the other areas of family patterns of interaction. Next slide, if you could. So what are the sources of these parent-child transaction difficulties? And I just want to take a couple of moments and focus on genetic etiologies, Down syndrome being primary with one. And you can see that there certainly could be some parent-child transaction difficulties as a consequence of expressive language concerns for the child, difficulties with respect to morphosyntactic weaknesses, and a problem that's unique to many children with Down syndrome, difficulties in task motivation. We go to the next slide. There's another example, Williams syndrome, which is again a genetic disorder, chromosome 7, a deletion syndrome. One of the primary characteristics, interestingly, is eye movement planning problems for children with Williams syndrome, which creates difficulties in visual exploration, in spatial cognitive abilities, and visual attention. And then over time, even during the early childhood period, you can see how these characteristics affect relationships, particularly joint attention, which is absolutely critical between parents and children to create positive gains in language and cognitive development. So you can see how stressors can occur in difficulties in joint attention, which with proper intervention may be able to maximize language and cognitive development for the child. Next slide, please. And the last one I just want to point out is Fragile X syndrome, with difficulties in emotion regulation, gaze aversion, working memory, social anxiety or motivation for the particular child can create lots of stressors for families. Next slide, please. We can be of great help to these families, especially as stresses appear, perhaps not early on, but maybe over some time during the course of the first 5 years of life. But I think it's very important to point out that even though we are supporting these families, this particular quote from Ami Klin gives you an idea of sort of the concept and the relationships that and the perception that we should have of parents when we work with them. And so let me just take a moment to read this quote from Klin. Engaging caregivers as allies in the treatment of children does not mean an intervention meant to correct bad parenting, and I need to emphasize that, or to somehow correct something that parents are not doing right. The causative disruption, the kinds of stressors that I'm talking about, of the child caregiver unit to development, is the instantiation of the child's genetic risk or other specific factors. And our work in early intervention really it's important to have that particular philosophy in mind. Next slide, please. So let's take this particular approach a little bit further and begin to think about a broad systems approach, We've already talked about child social and cognitive competence and family patterns of interaction. And I just want to emphasize here the power of family resources. And we understand the characteristics of family resources that can have a powerful effect on family patterns of interaction and even create environmental risk factors. If I go to the next slide to give you an idea of the power of these family resources and risk factors. This is the famous study from Arne Samaroff, who actually did a keynote presentation in St. Petersburg, Russia, for the International Society on Early Intervention and expanded on this. You can see it's the risk factors that we've been talking about. The greater the number of such risk factors, the greater the decline in this case, the measurement being verbal IQ. The power of this is really absolutely extraordinary. As you can see, this is 2 standard deviations, 30 IQ points that vary with the number of risk factors. So we certainly have a powerful source of influence on children's development, which certainly, in my opinion, operate through the family patterns of interaction that we've been discussing. Next slide, please. So this is putting this entire model together in the developmental systems approach. And the important point, if you look at the upper right-hand side, there's the functional adaptive behavior of children and their child goals and their engagement is a function of a child's social and cognitive competence and those developmental resources and organizational processes which are at the core of developmental psychology. They in turn are dependent upon the 13 family patterns of interaction, and the family patterns of interaction are in turn dependent upon the family resources that we just discussed. And hopefully we can optimize all of these components in this developmental system and try to minimize stressors that might occur to any number of these particular components. Next slide, please. So let me just quickly summarize the developmental science and my comments up to this particular point. We can see in the first bullet point that declines are possible due in part to stressors for all 4 vulnerable groups. That is the children in environmental risk, biological risk, developmental delay, and autism spectrum disorder. And I think a really key point and what I want to emphasize is that all of these developmental mechanisms that I've been discussing really apply to all groups. And this is, and I'll make that point a little clearer as I go on. And there have been lots of association studies so that all of these components, at least that we know, are associated with child outcomes. And we also know, of course, that there are unique adjustments that occur not only by group, but subgroup and individual children and families. But so through this developmental science, we can generate a hypothesis. And that hypothesis is that relates to the overall goal of early intervention. And I think from this developmental science, it is clear, and that our goal should be to optimize family patterns of interaction. Next slide, please. So let's move into the second major area that I want to talk about, intervention science. And there really has been a very fascinating early intervention translational process. If you look at if I turn to the next slide, this process consists of characterizing the vulnerable groups themselves, and that's what we've done so well in developmental science. We've studied their developmental resources and their organizational processes in great detail, language, cognitive development, executive function, etc. Next slide. And we can also then take the next step in this translational process to do observational studies over time. So we get longer term associations between time A and time B and connect that to the school, to childcare, home, community, and even do some laboratory studies. Once we've seen those connections, in this last slide, we do some intervention targets. We pick those targets from these associations They can be very narrow, focused ones or more comprehensive ones. It really constitutes our what we think of as a theory of change. And then we conduct early trials, either single subject designs, which I'm sure everyone is familiar with, as well as small scale trials. And ultimately, in the next slide, you can see randomized clinical trials, either focused or comprehensive. And if they are effective, we then try to figure out to make a practice application and also use that information to help characterize these vulnerable groups. So this next slide gives you a little bit more concrete example of this translational research cycle process, again, characterizing the groups. Then the observational study, we have parent-child language input and exchanges, something that's quite common to do. And when we do this kind of thing, we understand a lot more about the discourse framework. We're able to figure out that the characteristics of maternal responsivity, contingencies, the ability of families and to follow in their interactions with their child, how to elaborate effectively, how to construct balanced interactions. All of these are curricula that can be measured, curricula that can not only be implemented, but with careful measures. So those constitute intervention targets for early trials, single subject designs, again, if it works out, randomized trials, and then practical applications. And I'll talk about a practice model a little bit later in my comments today. Next slide, please. So let's take a little bit of a look at this intervention studies and see what the field of early childhood intervention has to say about the effectiveness of all the work that we've been doing with developmental science as the background. To do so, you really need extensive resources, as I think all of you know, and we often title that efficacy research. We also think because the field is 50 years old and we've been studying it for a while, most intensively the last 25 years, to pay attention to what's referred to as a counterfactual. Make sure you understand what the level of the control group is, the quality of the community that you're comparing the intervention to. And one of the best examples of that is the gradual process of increasing inclusion in most communities, certainly here in the United States. It's taken a long time for inclusion to reach a particular point that it is now. And that creates a new set of peer relationships, which can have a major impact on children's development. So that's an important counterfactual. And I'll highlight some of the connections to some of the work done at the center that I directed for many years. Next slide, please. So this is a study that I just always like to present because I think it was so well done. It was done in Greece. It was children that focused on parent-child transactions for a heterogeneous group of children with developmental delays. And you can see this was a comprehensive study focusing on a lot of the aspects of family patterns of interaction, the 13 components that I talked about. It was done with a structured curriculum and home visiting, and you can see there are benefits. The intervention group and the control group continue to show the decline that is common, as I pointed out earlier. Next slide, please. This is a group of preterm children in the largest study that was ever done. There were 8 sites in the United States. Our center was one of those sites. It was a 2-year program, quite comprehensive, including mostly the components of family patterns of interaction. And interestingly, there were the differences between the intervention and the control group were considerable, but that both groups still showed a decline. So the intervention was successful in terms of its comparison to the control group, but not successful in terms of maintaining the cognitive levels that children had during the first year of life. Next slide, please. If we focus on children strictly at environmental risk, this was a particularly interesting study, EduCare study going on in the United States and elsewhere. So a randomized controlled trial for children who were less than 19 months of age and help these children enroll in a child development center, which was true for the study for preterm children. So there was an opportunity to provide early intervention throughout the day. It was high quality, multi-site, had a local evaluation team from our center and had a family specialists were available, but I wouldn't say that was a very strong part of this particular model. So you did have significant effects of the early intervention. As you can see here, this is a effect size after 1 year of intervention. You can see the benefits for expressive communication, receptive communication, reductions in problem behaviors, and also some benefits to positive child interaction. Benefits weren't for all in all areas, as you can see on the bottom right, but still, this was a powerful effect of early intervention for the group of children at environmental risk. Next slide, please. Now, autism being so prominent nowadays, it's useful to think about what some of the origins were. This was the first study done on children who were finally identified with autism as toddlers. We could finally, in about 10 years ago or so, or 15 years or so ago, could identify toddlers with autism in a reliable way. This is the first study that then, once identifying those children, provided early intervention using much of the comprehensive model was done at our center. And as what you can see here, the intervention group provided some considerable gains over the first couple of years of the intervention. Control group provided some small gains. I must say, though, there were, not shown here, there were quite declines in development when measured by many aspects of the Vineland measure that most of us use. But the important point here is that now even we can identify these children as toddlers, that intervention and comprehensive intervention could be applied. Next slide, please. I just want to take us back a little bit while I have the opportunity, the Down syndrome, because Down syndrome has played such a prominent role in the field of early childhood intervention. This was the first study that was done in our center in the early 1970s, as we were beginning to think about the potential benefits and creating behavioral objectives. Those were the early days in which that was happening in 1970s. Look how long ago that was. And systematic sequences of development. And so these are children, as you can see on this particular slide, measuring motor development and adaptive behavior and language and personal social. The children during the first year and a half of life actually maintained the level of development that you would expect for their chronological age. So if you go to the next slide, there were just such excitement during that particular time. And I show you this picture taken for one of the children in that study. And I'll read you the caption. At 4 years of age and 1 month, Alan, who has been in the program, is the program at our center since infancy, readily reads 7-word sentences. Amazing, really, when you think about it, given the expectations for children with Down syndrome in the 1970s. Of course, this was an exception. The next slide, please. But we did see gains, preschool-age children with comparing control groups and intervention groups. There were certainly benefits on standard measures of IQs, in this case, the Peabody Picture Vocabulary Test, which is a common outcome measure. These are interesting. And the next slide, please, powerful effects for children with Down syndrome. And we saw many countries taking on this work, and later on, studies from not only the United States, but from Australia, from Israel, and other places were able to demonstrate at least we could prevent the decline in development from occurring for at least a select group of children with Down syndrome. So this is a very exciting period, in this case in the 1980s, with respect to early intervention, as so much activity was occurring in not only in the United States, but in countries throughout the world. Next slide, please. So now the question is, with that as background and the kinds of gains we could expect, what else can we do that would produce a dramatic benefit for children. Ibrahim, I see some, yeah, okay. A benefit for children. And I think I want to discuss the issue of inclusion because that was critical for Public Law 99-457, although it took quite a bit of time for states to gear up and programs to develop this high quality inclusion. But I think it was really important particularly because of the functions of peer relationships themselves. If we could enhance those peer relationships, we could perhaps even get greater benefits than the benefits we have already achieved in early intervention. As the bullet point indicates, first bullet point, it carries implications for cognitive, communicative, emotion regulation, and post-social domains of development. So peer relationships can have a particularly important impact on the developmental progress of children with delays or disabilities at minimum. And the second bullet point is also really an essential element. Peer relationships are in social integration at all levels. And ultimately, as illustrated in the slide earlier, it's really the key to independence and determination as children develop into adulthood. Next slide, please. So actually, we did have an example to test whether or not by providing services to children in inclusive settings, we can get some kinds of gains, particularly gains in this particular measurement of early literacy. The opportunity occurred in Oklahoma City, in the state of Oklahoma in the United States, because it began to provide universal preschool programs. So we could divide children at the beginning into those who participated in the program, the typically developing children, and those who didn't. And as you can see from this particular slide, for the first year of the program, the ages 4 to 5, the typically developing children gained considerably in early literacy. And so did children with mild and moderate delays who participated in that program, not as high as the children who were developing typically, but you can see the comparison to children who did not who were not selected to participate in that universal program in the first year or so, but ultimately would participate as the program expanded. So here we have some evidence of the benefits of inclusion, in this case in early literacy. If you take the next slide, we have further evidence of this case. This is Boston, Massachusetts in the United States, also created a universal preschool program and allowed a comparison between typically developing children and a broad group of children who had special needs. And what we're looking at here is effect sizes between those children who participated in the inclusive intervention program, preschool program, and those who didn't. And as you can see, gains were made by both groups of children, both groups of children, typically developing children and children with special needs. And the gains were to very similar extent. Typically developing children did better in early literacy than when they participated in the inclusive program. But nevertheless, even though children with typically developing were certainly performing better, there were some major gains with respect to this participation in the universal preschool program for both groups. Next slide, please. So a reasonable question is why this particular situation occurs. Could be motivation of the teachers, could be some families could be more engaged. It's difficult to really say. One reasonable hypothesis is that the peer interactions of the children themselves created an environment that stimulated lots of language interactions, social interactions, and participation in academic educational activities. So for this to occur, it's important that we understand that the children with delays or disabilities actually increase their social interactions when they participated in inclusive programs. And this, I think, was an early study that I did with a couple of colleagues of mine, which was a study which I looked at young children in a preschool program at baseline, as you can see in the slide. These are individual children that and we're measuring social category ratings and cooperative play. When we placed these children in inclusive programs, there was a substantial increase for virtually all of the children. And then when we provided a little bit of structure in that inclusive setting, we really got some dramatic increases in social play skills. So that suggests the possibility that perhaps the benefits of these inclusive settings for children could be related to the social interactions and the language interactions between children with disabilities and children without disabilities. The next slide reflects that's indeed what turns out to be the case in a variety of randomized controlled trials over the next decade or so. If we look at children who participated in inclusive programs, the positive interactions was quite high compared to children in specialized programs. If you look on the right side, this was a study that I conducted a number of years ago to give you an example. These were children who all were in inclusive programs, and I superimposed the curriculum of the developmental systems approach on top of that, emphasizing relationships and comprehensiveness and continuity. This was a 2.5 year intervention program. And as you can see, the intervention children in inclusive settings did much better than the control group children in this particular case in responsiveness to peers, but there are so many other measures in which they benefited as well. So it appears as though we have a very nice evidence for the importance of inclusive programs, perhaps creating even additional benefits from the curriculum that exists that also provided some positive impact for children. If I could see the next slide, please. So some of you may be wondering, how do you even measure these kinds of things, the social interactions of these children? It's such a complex a matter to do so. And so I just wanted to just show you this slide to give you an idea. This is from my laboratory, if you will, which is my preschool at our center. And I could bring children into this particular preschool program and match them in developmental level, language, chronological age, number of siblings, socioeconomic status, length of time they knew other children, all sorts of things, bringing them in for a week or for a month or for many months. The children wore radio telemetry microphones in the vests, and we could measure all of the types of social interactions that they did. And I could control all of the characteristics of the children, which is a wonderful way to help study the important factors that might govern the most positive effects of inclusion. The next slide, there's a lot of work to do that. Once we had these data from the videotapes of these children, then we could apply all of our measurement tools for individual children to get an idea of the changes in both outcomes for specific social interactions and at a later point, other types of measures. Next slide, please. So here we see some really powerful effects of early intervention, and it's wonderful to be part of this community. I emphasize the benefits for children, but of course there are so many benefits as well for family outcomes, some of which are illustrated in this particular slide. Next slide, please. So then we can ask the question that I asked really at the beginning. How successful has this focus on early childhood period been? Pragmatic humanitarian equity goal? I think indeed we've been able to strengthen families and provide them with greater access to inclusive community services. We've also capitalized on plasticity of children during the first 5 years of life. And we have considerable evidence for our ability to enhance child development in so many characteristics of social and cognitive competence. And we also have lots of evidence about our investment for long-term benefits that's paid off. Uh, More children working, participating in early intervention programs, and similar, there's evidence about improvements in their quality of life. So indeed, in many high-resource countries, and properly so, early intervention should be expected and accepted. Next slide, please. So let me again circle around and talk about current status, although and I've emphasized the great gains that we've made, and these are indeed great gains, which we should be proud of. I think it's also important to look at the current status and things that we can improve upon. So let me go over these bullet points and then talk about some potential solutions with respect to the major theme that I have in the future directions for early childhood intervention. So it's true, without question, that replication of early intervention in many communities, especially when you scale up, is inconsistent and often, sometimes, and more often than we would like, yielding minor effects. If we measure long-term benefits, sometimes we see fading, and that's a concern for us. In the United States in particular, and I'm sure in other countries as well, our personnel preparation is less than adequate in many programs. We need to be much more consistent in terms of identifying evidence-based practices and the components of implementation science. And sometimes it's difficult to get coordination of the service system components in health and childcare, social services, behavioral health. It's without question, as all of you know, who provide services, who have been involved in early intervention, this is quite a complex process, even for communities which are most supportive. And this is creates financial demands without question to provide any kind of high quality service, given the fact that especially important that early intervention, because of its not only short-term but long-term impacts, requires considerable financial resources. And it also, in order to do so, those resources must be applied in a comprehensive manner and with continuity over time. So for those programs which are not as high a quality as we'd like, we have a number of major concerns, and it's important to identify what those concerns might be. And I would argue that the major concern is the absence of a systems approach for a common set of goals at every level. Role of families, theory of change, expectations for intervention outcomes, and an evaluation process. Next slide, please. Let me take a moment before I explore that in a little bit more detail and talk about the outcomes of the translational process that I illustrated before, and talk about some of the challenges, even though we've been successful because of the diversity and the complexity of the intervention approaches that we've taken. The next slide, please. So we've developed a wonderful set of curricula for children in environmental risk, the PALS curriculum, Carolina curriculum, Educare that I've talked about, etc. We've done a wonderful job, usually focusing on categorical groups. The next slide, please. Same is true for children at biological risk. We have such wonderful programs, particularly the Infant Health and Development Program was the one I illustrated from that 8-site study. But we have others, massage therapy, kangaroo care, all of these that have proven benefits to children. Next slide, please. Certainly that's the case for children with developmental delay. Many of you are familiar with the routine-based intervention and prelim milieu therapy and enhanced milieu therapy and all sorts of other kinds of curriculum, and only illustrated a few here. The next slide, if you will. And of course, there have been a large number of curricula for autism spectrum disorder, playing language for autistic youngsters, etc. The Early Start Denver model, which was developed with Sally Rogers and at our center as well. And there are many curricula that contain the components of family patterns of interaction. So if the next slide we can see, we have this amazing array that our community has created, our early intervention community of curricula to support children within these categorical groups. If you take a look at the next slide and we focus on some of the future directions, what would make things much easier in the future, now that we have a set of developmental mechanisms that we understand and a conceptual framework that we understand, and we understand as well the 13 family patterns of interactions supported by family resources, we can run these curricula through the net, as you just saw, to establish a particular program for individual children using these mechanisms, conceptual framework, and family patterns of interaction in particular as criteria for selecting those types of intervention. If I can see the next slide. So the key point here is that we now have conceptual evidence within the developmental systems approach, and it's a framework that applies to all children. And its value is such that it reduces the complexity of interventions, as we saw, as selecting through that net. It reflects the similarities and the overlap among children and families. These are really common. And it focuses most importantly on developmental mechanisms that we have derived from developmental science. We can select and adapt strategies for high priority family patterns of interaction, and we can do so with some child goals. And I'll talk about that in a second. And we can also incorporate, as our field expands and the science expands, to incorporate etiologic specific information, as well as family resource components as this becomes available to us. And the next slide. I just want to just point out this community implementation slide, and because it's important to talk about implementation science itself, because that's one of the common issues, that difficulty in scaling up to communities, and implementation research can be of great value. We certainly have efficacy studies, as I've talked about, and effectiveness studies, sort of broadening it, and implementation research that we can take this pipeline of research to enhance community programs as it becomes available. But certainly we need a focus on implementation research as well, an early phase of early intervention, the beginning at an early phase of early intervention. And we have a long way to go to figure out the best ways for implementation research to be effective. Next, if you could. So let me talk about the last component of the future directions of early intervention and focus on a practice model. So in point of fact, everything that I've said to you before really is of no meaning and of no relevance unless it gets translated into a practice model, something that is really functional, something useful for children, families, and could be effective in communities. And something, though, that is connected to the developmental science and the implementation science and the effectiveness that we have talked about before. So let me just focus on engaging in the practice model for thinking about future directions, engaging in problem-solving process with the family and intervention in order to, which again I think is the goal of early intervention, to optimize family patterns of interaction. Next slide, please. So in order to have an effective practice model, we need to focus on initiating problem-solving practice without question that focuses on child's development, but most importantly on family priorities. So how do we do that in the context of a family narrative and in the context of child development? And I think one of the best way to do this is to establish a communication with families and focus on a variety of key bullet points which are at the core of child development. Certainly, we've talked about you're familiar with participating in family activities and routines in particular. That's usually a good icebreaker. Exploring the environment independently and gaining information, communicating for social purposes. And these other bullet points are designed to work closely with families to identify their priorities in these key areas of child development. And I have some uh, material that would be relevant to these kinds of things, and I will talk a little bit about it as I go into the next slide as we discuss the practice model in a little bit more detail. Next slide, if you could. So in this practice model now is a is a is a an effort to link all that I've talked about in developmental science and intervention science and implementation science and put it into a model that we can use to support children and families. So let me, in the time I have, just a moment to discuss just the key components. If you could go to the next slide. We begin obviously with connecting with families. We certainly need to do formal assessments, establish eligibility, and focus on follow-up assessments. The next slide. Let's see. We want to focus on the child context. After that, their developmental level, behavioral patterns, and their special interests. And then next, if you could. And then I think we need to, after we've already established all of those two things, apply the family narrative in the bullet pointed developmental areas that I talked about. So if we go to the next slide, we could have an opportunity to establish children's goals and in the context of those family priorities. The next slide. Then we can identify those settings that are important with but making sure that we have a focus on family patterns of interaction. The next slide. And we can then decide about what the settings would be appropriate for a home or peer social group or a special program perhaps, or family events. Then we can do what we normally do. Focus certainly in the United States and many other places. We need to develop, once we have the goal area, objectives, interventions, the individualized family service plan, and the individualized education plan. And the next slide, please. And then create interventions linked to family patterns interaction. And as you know, our field has created such wonderful interventions, which we can select as long as we link them to family patterns of interaction in this practice model. Next slide, please. And then we do an evaluation, of course, of the objectives over time, family patterns of interaction for a particular goal area or areas that the family and the team select. Next, please. And then we would certainly have a general family narrative discussion in developmental areas over time to just keep families and the team focusing on the practice model itself. Next slide, please. So when thinking about a practice model for the future, I get excited about it because I think it has the potential to be transformational. There are a number of central elements, and in the last couple of slides, let me just mention what they are. It recognizes the same developmental mechanisms, and I do want to highlight the importance of that. That is, those developmental mechanisms are the same, irrespective of categorical or an ideological diagnosis. The model is guided by a system of interacting developmental mechanisms within the developmental systems approach. It follows parents' goals and expectations, and the family narrative is a useful tool for that. It follows principles and relationships and principles of relationships and comprehensiveness and continuity, which I think are key features of early intervention. The model itself supports inclusion, the issue of importance of belonging, equity, and interdependence among children and all of us part of this community. And indeed, it enhances a community development because not only does it talk about family panels interaction and the importance of families and teachers and staff and program people of all sorts, uh, but it is an effort to create community development and emphasizing family patterns interaction. So the overarching goal then is to provide support for families to fulfill their aspirations, to be sure, and provide the tools for children to carry out their interpersonal goals. And I think that is, without question, the essence of early intervention. The next slide. And then the final two slides, for those of you who want to think about this in more pictorial fashion, as I do tend to think that way often, if we want to consider implementing a comprehensive and inclusive community-based system, I would suggest that we do have a conceptual framework. And I think that is buttressed and relies on developmental science, as you can see here. I think we clearly have an evidence framework and we have a wonderful intervention science. And when we put those together, if you go back, and if we go back into conceptual framework and evidence framework, that tells us what to implement. And what to implement, then we rely on an implementation science, which helps us tell us how we should implement. And then we have a practice model. And that practice model is all linked to everything that's above it and also feeds back into development and intervention science. Next slide, please. So indeed, we, in this particular slide, want to emphasize the importance of an early intervention system with a relying upon this wonderful system of supports, which can be certainly improved without question. And we have a particular focus to improve it by enhancing family patterns of interaction. And that is certainly the major direction that I see for the future of early childhood intervention. And thank you so much for listening and very appreciate your attention.
Thank you, Mike. I appreciate for your time and concern, and we got you really tired, I think. I, it, okay, yeah. I